As of 12 p.m. today, we have an additional 334 cases in Singapore. My Director of Medical Services, Associate Professor Kenneth Mak, will provide further details later. It has been just about a week since the circuit breaker measures have kicked in. By and large, Singaporeans are taking the measures seriously and are staying at home in the past week. Public transport ridership and traffic volume have dropped by more than 70%, and close to 80% of the workforce are now working from home. Crowds have thinned in the public places. Enforcement officers have also observed greater compliance with safe distancing measures over the past 1 week. We thank everyone who is playing their part to stop the transmission of the virus. But we cannot be complacent. We still see a few cases of people loitering or gathering in public places. The authorities have issued more than 6,200 warnings and over 500 fines since 7th of April. These safe distancing measures are put in place to slow the transmission of the virus, and more importantly, to protect Singaporeans. Therefore, we must take these measures seriously and keep a safe distance from one another. We remain in a critical situation. The number of cases has been increasing, and yesterday we saw our highest daily tally so far at 386. In particular, the number of cases among foreign workers, especially those in dormitories, rose sharply to around 200 cases per day and reaching around 300 cases yesterday. This increase is likely to continue as we undertake more testing at the dormitories. The outbreak in the foreign worker dormitories has become an important front in our fight against COVID-19. Our foreign workers have contributed much to Singapore, and we are paying close attention to their health and well-being. And that is why we have set up a joint task force with Senior Minister Teo Chee Hean as our advisor to address the outbreak in the dormitories. Our foremost priority is to keep our foreign workers safe. We have mobilized our medical resources to support the joint task force efforts at the dormitories. Our medical plan entails identifying those who have been infected or exposed to infection, test and contact tracing, isolation and care for the infected workers. All infected foreign workers will have their welfare taken care of. Overall, we expect the number of cases to continue to rise in the short term before it stabilizes, because it will take time for the circuit breaker measures to take effect. With the rise in the number of infected cases, our healthcare resources are stretched, but we are still able to cope. I would like to take this opportunity to thank our healthcare workers who have responded quickly to this new situation and they have made the necessary adjustments. To further free up precious hospital resources, we have set up community care facilities to take care of those who are clinically well but who still need to be isolated and monitored. Most of the foreign worker patients are young and few have underlying conditions. Hence, we expect that few would need extensive medical care. At the care facility at Singapore Expo, 2 halls are now operational with a total capacity of about 950, and the third one will be operational shortly. We are progressively expanding the capacity at Singapore Expo. We are also exploring additional capacity for such care facilities to give us a greater buffer. Each of us must take the circuit breaker seriously. This is the only effective way to slow the transmission of the virus. We must work together to terminate and to disconnect this chain of transmission so that we can come out of this together. Now I would like to pass on to my Director of Medical Services to share some details on the medical cases.
Thank you very much, Minister. To expand now on the figures, and you'll have to check this for accuracy against the press release that will come out this evening. As of 12 noon today, we've seen an additional 334 new cases. Of these new cases, none of them are imported cases. 189 of these cases have been linked to named clusters. 23 of them are other local linked cases. And 122 of these cases remained as yet unlinked. Further investigations and contact tracing are taking place, and we are hopeful that out of this 122 cases, a number of them will be recategorized into being linked cases, whether to other individual cases or to the clusters. We have seen a number of these patients, in fact, come from the dormitories, both from the purpose-designed dormitories as well as others. And within the dormitories, the Joint Task Force remains committed to doing their best to look after the workers who are unwell in the dormitories. Medical teams have been established within the dormitories, and we continue to make sure that there are medical services available, working closely with the Joint Task Force to ensure that that is indeed so. And within some of the dormitories, swab testing under an active case finding approach has commenced. And as swab testing activities continue, we fully expect more confirmed cases to emerge as a result of our surveillance activities. Concurrently, we have worked to expand our facilities, both in our swab and isolation facilities, but also in our community care facilities. And Minister has alluded to this community care facility that we have recently established in the Singapore Expo. Yesterday, they had 297 residents in the community care facility, and we expect another 150 more patients to be admitted into the community care facility today. And they come from a variety of different places, including from the dormitories. They come also from acute hospitals as a result of us being able to transfer the well recovering patients into the step-down care setting. And a number of them, in fact, come across these different settings as well. As of now, the patients who are in the community care facility are well, and they are looked after by the medical teams that we have established within the two halls at this community care facility at the Expo. Thank you very much.
Thank you. I'll now invite Minister Josephine Teo to give an update on the operations at our dormitories.
Good evening, everyone. Our immediate priority is for the workers in the dormitories to stay healthy and to minimize the number that get infected. It is a huge responsibility, and that is why we are mobilizing resources from across the whole government to make it happen. And this is also why the Interagency Joint Task Force was set up. I think it will be helpful if I provided first an overview of the dormitory landscape in Singapore. We have 43 purpose-built dormitories that together house about 200,000 workers. There is a very specific reason we built these dormitories. They tend to be quite large. They house anywhere between 3,000 to 25,000 workers. The specific reason for building these dormitories was to have communal living. It was designed, or these dormitories were designed for communal living, meaning that we want the workers to be able to be with their friends, prepare the meals that they like, and practice their religious beliefs. With scale, these dormitories are also able to provide common recreational facilities, such as TV rooms, gyms. We were also able to put in other facilities like mini-marts, remittances, and Wi-Fi. And so when you put it together, really the purpose-built dormitories are to provide a supportive environment to the workers. The dormitories are professionally managed by a firm, or what we normally refer to as the dorm operator. These dorm operators are regulated, and they have the responsibility to ensure that standards are met. For example, making sure that there is modern sanitation and also no overcrowding. In terms of sleeping arrangements, what does it look like in a typical purpose-built dorm? Well, if you imagine a badminton court, and then you take half of the badminton court and you put 5 bunk beds in them, that will be able to sleep 10 people. And then you add another 20% to that half of the badminton court for circulation space. That is essentially what a typical room would look like in the purpose-built dormitories. So that's one group of dormitories. We have another type of dormitories. We call them factory-converted dormitories. We have 1,200 of them, and collectively they house about 95,000 workers. These factory-converted dorms tend to be smaller. They are perhaps between 50 to 100, but some that are larger can be around 500. Now, these dormitories are either managed by the employers themselves or professional operators. They have the advantage of being closer to the workplaces. They are also regulated and must meet standards for hygiene, for space, and also, for example, fire safety. And based on these regulations, they are inspected, and if there are findings, then the operators will be asked to rectify them. So that's the second type of dormitory. Then we have a small number of what is known as construction temporary quarters or temporary living quarters. They tend to be no more than 40 persons each, and we don't have so many of them, smaller number. So that is what the dorm landscape looks like. Now, what precautions have we taken at all the dormitories? Since the COVID-19 outbreak, I think firstly, we tried to limit the inflow of foreign work pass holders so that we could manage the risk of imported cases. That's the first thing that we did. We reached out to all the dorm operators to remind them to be more vigilant. Then we also produce materials in the workers' native languages to encourage them to take steps to protect themselves. Subsequently, non-essential facilities like gyms and TV rooms were closed. Meal times and recreational hours were also staggered. Intermixing between the blocks, we put a stop to it. So those were the precautions that took place. The question, of course, is why then has there been such a spread amongst the workers staying in the dormitories? From the epidemiological findings, there is evidence to link the workers in the dormitories to common work sites. Then, the workers from the different dormitories on their rest days may also gather. And so they may socialize and shop at popular places like Mustafa. Now, back in the dorms, these workers would then socialize with another group of friends. They might, cook together, eat together, relax together. So despite the safe distancing measures that were in place then in these dormitories, the virus in the dorms spread through socializing activities, much like it would spread amongst housemates, friends, and also in the community. This may explain why, all the way up to middle of March, the workers who lived in dorms that tested positive for COVID-19 were few and far between. But then, in quick succession, in some dormitories, not all, in some dormitories, many popped up. So what are we now doing to contain the spread? It is a three-pronged strategy. First, in the dorms, where there are already clusters, we will actively contain the spread. Now, it means locking down these dormitories, no more moving in and out. Workers have to stay in their room as much as possible, minimize their interactions with other workers. Meals are provided to avoid communal cooking, and those that have to use communal toilets have scheduled, staggered shower times. We are also testing the workers to identify and isolate the infected ones and closely monitoring the health of the other workers. So that's the first prong. Second, it's useful to note that not all the dorms have clusters. In fact, 29 of the 43 purpose-built dorms and almost all the factory-converted dorms, they have no clusters. Hence, for these types of dormitories, our aim is to prevent the clusters from forming. All those in these dormitories that are tested positive and their close contacts would already have been isolated separately. While these dorms are not gazetted as isolation areas, we aim to apply the same safe distancing measures so that they are effectively also on lockdown. Likewise, the workers have to stay in the dorms. Within the dorms, we enforce strictly the safe distancing measures, which means no more cooking and freely mixing with friends from other housing units. So that's the second prong. Third, across all 43 purpose-built dorms, we have moved out or separated the workers in essential services who are still needed by their employers to go to work. This is now about 7,000 of them. We put them in separate facilities so that they do not have to enter and leave the dorms daily or interact with the other dorm residents. To provide a higher level of assurance, medical screening was conducted to ensure that the workers did not have symptoms before moving into the alternative accommodation. All the workers were screened before they moved to the alternative accommodation. In the meantime, while at the workplace or traveling to work, they are required to also implement strict safety distancing. This includes wearing a mask at all times, not interacting with other workers, and eating meals alone. And like all Singaporeans, they will be required to remain in their residences after work. We hold the employers of these essential workers responsible, and we look to them to do their utmost to keep their workers safe even as they go about their duties. Now, what we have done to move out or separate the essential workers in the purpose-built dormitories, we will also do for the factory-converted dormitories. Move them out, monitor them, screen them, all of them. The moving out of workers from all the dormitories, purpose-built or factory-converted dorms, will help to create more space for isolation facilities within the dorms, so that we can house separately the workers who are unwell or are waiting for the results of their swab tests. So those are the three prongs of the strategy. Now, to implement this three-pronged strategy effectively, there are also three key enablers. The first is the fast teams that I've talked about. For all 43 purpose-built dorms, we have deployed the fast teams, and they have been on the ground since last Wednesday, working round the clock to implement safe distancing measures. I visited some of the dorms comprising and interacted with the fast teams, which comprised of SAF, SPF, as well as MOM officers. They understand their mission to put the well-being of the workers as the top of their priority. They sort out issues with food, as well as cleanliness. They keep in close touch with the workers and attend to the feedback from the workers. They are a great help to the dorm operators, and we will soon deploy roving fast teams to also support the employers or the dorm operators for the factory converted dormitories. So that's the first key enabler. The second key enabler are our medical support teams at the dormitories. These are also being stepped up progressively. These medical outposts at the dormitories are supported by the regional healthcare systems, which deploy teams of doctors, nurses, and technicians to the dorms. They tend to the workers who are unwell, swab those who have acute respiratory symptoms. They manage the cases that need to be sent to other facilities, and then they will also assess if the workers are well enough to be returned to their rooms. Their presence in the dormitories gives great confidence to the workers who are there. The medical teams will also work with the FAST teams to set up on-site isolation facilities. We now have 8 medical outposts set up at the gazetted dorms and aim to have medical touch points at all 43 purpose-built dorms. Now, most of the other factory-converted dorms, they are already well supported by the national network of PHPCs, the Public Health Preparedness Clinics. So the workers in the factory-converted dorms can also get timely medical attention. So that's the second key enabler. The third key enabler will be the dormitory operators as well as the employers. Now, the more the dorm operators can handle the food and the hygiene matters, the more the FAST teams can focus on effective safe distancing and tackle other issues. For example, expanding the isolation facilities on site and helping the workers to remit monies home. A big part of the workers' sense of well-being is to be able to continue to receive their salaries. It's important to them. And this is where the employers have a duty to ensure that it is done so promptly in a timely manner. So to recap, we have a 3-pronged strategy for the dormitories. Contain the spread in the dormitories where there are already clusters. Prevent the spread in the dormitories with no clusters, and move out and test all the workers who are still needed for essential work. We will also ensure that the 3 key enablers are properly stepped up. The FAST teams, the medical outposts, which implement the medical support plan, as well as the dorm operators and the employers. There will be quite a lot of adjustments required of the workers living in the dormitories. They cannot go out to work or meet their friends, and we would have to help them to adjust and to keep them safe and healthy. In summary, we thank the workers for their cooperation. We have a responsibility to these workers, and we will do everything we can to take care of them.
Thank you. I'll now invite Minister Lawrence Wong to give an update on the safe distancing measures.
Good evening. It has been 1 week since the circuit breaker kicked in, and we are very happy that many Singaporeans and residents are cooperating and doing their part in complying with these measures. As you heard just now, movement all over the island has reduced significantly. Our safe distancing ambassadors and enforcement officers are hard at work on the ground, and previous hotspots that we had highlighted, including the wet markets, the hawker centers and parks, are generally now under control. Most people are doing the right thing. There are a few who are not, and they will be dealt with. But just 1 week into the circuit breaker, we know there are some people who are finding it hard to adjust. Some are suffering from cabin fever. We receive many appeals to do all sorts of activities, and we've had to reject all of them. Because basically, we cannot let up at this stage. These are still early days, and we have at least another 3 more weeks to go. So we have to double down on our efforts and just stay at home. When we started the circuit breaker, we were very mindful not to disrupt certain of our supply chains or to disrupt essential services that are still needed for daily living. Now, about 20% of the workforce are continuing to work under essential services. There have been appeals at the start of the circuit breaker. We have cleared the appeals. So having cleared the appeals, we will now proceed to look at the list of companies that are still working, classified as essential services, and we will tighten this list further with the objective of reducing further the people who still need to work so that more can stay at home and we can further minimize people movement all around. We will also continue to be very firm and strict in enforcing and implementing the circuit breaker measures. We have gone straight because sufficient warning has been given to everyone. So immediately for the first offense, it's a fine of $300. The second offense will be a fine of $1,000 or prosecution in court for egregious cases. And we've issued more than 500 fines to date. For foreign residents who are caught breaching any of the rules, then on top of the fines, we will not hesitate to revoke their employment or work passes or even their PR status. During this circuit breaker period, we will make a further change to our guidance on mask. We had already updated our advisory on mask earlier based on the latest medical and scientific advice, and that's why we went out to distribute reusable masks to everyone, and that exercise has completed over the weekend. So we will now take a further step and make it mandatory for everyone to wear masks when they go out. There will be some exceptions or exemptions to this rule. For example, for very young children, those below the age of 2, the medical experts recommend not to wear masks because of child safety, so that group will be exempted. For those who are engaging in strenuous exercise, like running or jogging, then you can remove the mask when you are engaging in strenuous exercise, but after that you have to put the mask on. And when you are engaging in running or jogging, then make sure that you are maintaining a safe distance between yourself and others. Other than these exceptions, everyone else going out will have to wear a mask. And we will enforce this rule too, like all the other safe distancing and circuit breaker measures that we have put in place. Basically, as we have explained, we are dealing with 2 infections in Singapore. One, in the foreign worker dormitories, which Minister Josephine has highlighted and elaborated on, and second, in the general population. The infection in our foreign worker dormitories is a very challenging task. It requires new organization, new protocols for dormitories and workers. It requires strict and firm measures, but at the same time, empathy and understanding for the well-being and needs of the workers who have done so much for Singapore. So we are sparing no effort to doing all we can to ensure the safety and health of these workers. For the rest of us in the general population, we are continuing with our efforts to do contact tracing each time a new case pops up, and we have the circuit breaker in place. So all of us should comply with the circuit breaker measures, not just to avoid the penalties, but to protect ourselves and our family and our loved ones. The health of all Singaporeans depends on each one of us, and we can beat the virus together.
Thank you. Now I open the floor for questions.
Thank you, Ministers. DMS, we will now begin with the Q&A. Media agencies, please remember to use the raise hand function on Zoom if you would like to ask a question. May we now have the first question from Chow Pao. Wei Mun, please.
Hi, thank you. Wyman from representing Cao Pao. Can we have more clarity on the dormitory situation? How many more essential service foreign workers are not yet decanted? And by the meaning of list of essential services firms tightening, by how much less workers? And in terms of factory converted dormitories right now, can Minister provide more details on how many among the clusters right now are factory converted dormitories? Which one is it? And are there more confirmed cases coming from FCDs as mentioned in the advisory that MOM distributed yesterday to employers? Thank you.
Thank you. I'll ask Lawrence to talk about the essential services. Then the Josephine Teo will answer the questions on the dormitories.
Well, on essential services, the ones that are continuing to work, the ones from the purpose-built dorms that are continuing to work, we have largely already completed the movement of these workers to alternative accommodations. So that exercise has already completed, and they are continuing to work. The key is this: every time we move them out, we will test all of them to make sure they are healthy, and then we will provide alternative accommodations for them because they will be continuing to work in our community. So that exercise is complete. The question about whether or not, how much more are we going to trim the list of essential workers, that is ongoing, as I mentioned. For now, 20% of the workforce are deemed essential, including foreign workers in that midst, right? So that group of workforce is about 20%, and they are continuing to work daily. As I said, we would like to bring that figure lower, and we are looking at ways in which we can trim down, and when we are ready, we will provide more details.
Perhaps I should just clarify that the 20% who are working refers to those that are still commuting every day to work. There's still a substantial workers who are telecommuting. So they're actually working from home, and the numbers will be a dynamic number depending on whether they continue to be active, to be involved in the economic activities. But a large proportion of Singaporeans continue to work from home. Now I pass it over to Josephine.
Thanks, Wyman, for the question. I mentioned earlier that we have about 1,200 factory-converted dormitories. And as of the last set of data that was available, in 37 of them, there were some cases. Most of them have very few cases. We're talking about low single digits. But we do have one or two of the factory-converted dormitories with cluster. But they are a very small minority of the factory-converted dorms, which is why we are stepping up our inspection. By today, we would have done an inspection for all the factory-converted dormitories over the last 2 days, in fact. So when we go out to these factory-converted dorms to do our inspection, the protocol has also changed. Whereas in the past, our inspectors would look out for hygiene standards being met, fire safety standards being met. Now, the protocol also includes looking into the well-being of the workers in these factory-converted dormitories. We want to know whether the dormitory operator, who may be the employer themselves, have been keeping track of temperature of the workers, for example. They are required to perform twice daily temperature taking. They are also required to inform us if any one of them is unwell so that we can keep track of how things are shaping up. So these things are already carried out. And as I also mentioned earlier in my remarks, The intention is to also have roving fast teams support the factory converted dormitories, because now we do not want them to do any cooking, and so food will have to be arranged and provided for. And over and above this, we also want to make sure that the workers, if they are unwell, they know where to seek treatment. Generally, it should not be a problem because they will have the network of PHPCs to tap on. But where they have difficulties, then we want to move in very quickly. Now, on the factory converted dormitories, we're not working alone. Apart from the Joint Task Force also having a supervisory view of the factory converted dorm situation, we are working with non-governmental organizations. This includes the Migrant Workers Center, as well as organizations like HealthServe, in order to be able to take care of the workers, not only in the purpose-built dorms, but also in the factory converted dorms.
Next question.
Okay. We will have the next question from BH. Atia, please.
Hi. You mentioned about being mandatory for everyone to wear masks. Can you get some clarity on these, and what are the penalties for those who do not wear masks?
What is the clarity that you're seeking again?
So, are there penalties?
Oh,
What kind of
penalties specifically. Okay.
Yes, for those who do not wear masks, and any advice or anything like that.
All right. So on the issue of wearing masks, as I said, we had updated our guidance earlier and advising people to go out, when they go out, to wear a mask. So that had already been updated. The change today is that we are making it mandatory, right? And in fact, we had started earlier by making it mandatory in certain settings, in public transport, in wet markets, in supermarkets. But now that we have distributed the mask to everyone, and that we have and generally people have started to adjust to the new requirements or the advisory, we are making it mandatory for all. The minute you leave your room or you leave your house, you have to wear a mask when you go out. So there will, because it's a mandatory requirement now, there will be penalties, the same penalties for safe distancing and circuit breaker measures will apply. First offense, $300. Beyond that, $1,000 and possible prosecution. So it's the same penalties for failure to comply with any of the safe distancing measures. This will be yet another safe distancing measure that we are now putting in place.
Next question.
We will now have the next question from FT. Stephania, please.
Hi, hello. I have a couple of questions. The first one is with regards to testing foreign workers in dormitories. Are you considering, by any chance, trying to test essentially everyone or more people in dorms, just by virtue of I know you already mentioned the fact that you're also testing those that might be asymptomatic, or some of them, but just by virtue of how densely populated these structures are you considering ramping up testing there further? Could you also mention how many more foreign workers you are planning on moving out, in addition to the about sort of 7,000 that you already have moved out?
I'll ask DMS to talk about the testing strategy, and then Josephine can comment on the moving out of our workers from the dormitory.
We are working out the testing strategy with our colleagues in the Joint Task Force. At this point in time, for the majority of the purpose-built dormitories, we don't have an approach of testing everyone at this stage, but it's a much more targeted approach of testing those who step forward, who are sick, who have symptoms, and in an active case finding, active case surveillance approach in dorms of concern. The Joint Task Force has also arranged for testing of confirmed cases so as to further identify possible other patients who may as yet not be symptomatic, but in fact have already been infected, and they would all then, with the positive test result, be isolated to prevent further spread of infection to other workers within the dormitories. In other settings, we have tested workers across very specific other settings across the board. You no need to give assurance that in those settings, these workers are in fact not infected at the point in time that we test them. An example was given by Minister where we had shifted workers who belong to the essential firms, essential services, and as we were moved out, we in fact had also tested them and continued to test them to make sure that they do not have any workers among their midst who are in fact infected and therefore pose a further risk to other foreign workers who live with them and work with them as well.
So to the question of moving out and separately housing the workers, there are really two objectives that we are trying to meet. One is to enable the essential services workers who still need to go to work, not to have to move in and out of the dormitories on a day-to-day basis, and therefore have interactions with the residents who are otherwise still remaining in the dormitories. So we've already done so for the purpose-built dorms. We are going to do this for all the factory-converted dormitories. We are tabulating the numbers, and we can provide an update when that is available. But I also want to mention that even for the purpose-built dorms from which essential services workers have been moved out, we do want to be able to create isolation facilities within the dormitories. Remember, we mentioned that there is a medical support plan that has to be implemented. Part of that medical support plan, which you got a full briefing on, is to be able to take care of the workers whilst they are being swabbed and waiting for the results, or if they have been swabbed and then we need to find some way to let them serve out their medical certificates. Say, for example, the physicians have decided that they should be on MC and not immediately put back into the rooms. So to have these isolation facilities, we will also have to look at the specific conditions in each of the dormitories. They are all configured differently. In some cases, there is car park space available that we can free up to serve as the isolation facilities with proper equipment put in, as well as making sure that a level of comfort can be achieved. In some other cases, there may be rooms that are freed up that we can use. So we will have to look at the specific conditions in each of those dormitories to identify areas that can serve as isolation facilities. And if it is necessary to move out some of the residents in order to free up these isolation facilities, we will do so.
Next question.
We will take the next question from Channel 8. Kari, please.
Thank you. Hi. I wanted to check, right, why there's a sudden change of the mask guidance. Is it because there's now the transmission rate is higher? Because earlier US research shows that this coronavirus might be able to transmit through talking. So what's the MOH stand against this? What is our current R0 right now? Because currently worldwide R0 is 2 to 3%. What is so how about in Singapore right now? And then the second question is, just now Minister Lawrence Wong said that you all are targeting to tighten the list of essential services. So what type of essential services are you looking at? Thank you.
So I'll ask DMS to talk about our R0, and then perhaps Lawrence can talk about the mask and the essential services.
The R0 basically is that figure that represents the extent in which further transmission takes place from one case. And we look predominantly not just at R0, but actually what we describe as the effective R, looking at this. And until the outbreak had taken place within the dormitories, we in fact had the R, effective R that in fact was well below 1. We haven't done the complete calculation yet for the workers that come out from the dormitories, because you actually need to follow this cluster through and to determine whether or not onward transmission actually takes place. But my understanding is the RT has in fact now crept up. I think it's somewhere closer to the 1 mark, but I'll have to check that, and then perhaps once that information is available, then make that known to all of you.
So on the question on mask, actually the main change had happened earlier when we updated our advice on mask based on the latest findings and medical advice or scientific evidence, right? And there were two reasons for this, as we have already explained. Number one, the evidence or the finding that people without symptoms or with very mild symptoms could be spreading the virus. So the earlier advice was you wear mask to protect others, right? To keep your droplets to yourself, especially when you are sick. But if you can spread the virus, even if you don't have symptoms, then you may not know whether you are sick or not sick, but you may inadvertently be spreading the virus. So that was one key reason why we changed our advisory earlier. The second reason was, as we said, there are already some indicators that the indications that the virus was circulating in our community, and there were more undetected cases within our community, which was a cause for concern. And therefore, we had already changed our advisory earlier to recommend the wearing of mask, particularly when you go out and you cannot avoid close contacts. And indeed, over the last weeks or so, recent days, you are seeing more people wearing masks. What we are doing now is a next further step. Same reason, same findings, but a next further step just to make it mandatory and to take that extra protection and precautions so that anyone going out, right, in any setting, wear a mask. And I think that will be an extra precaution worth taking for all of us. On the second point, on essential services, we have been quite, as I said, when we started out with the circuit breaker, quite mindful of wanting to ensure there was no disruption to our own essential services for daily living, our supply chains, particularly since in Singapore we import so many things that we need for daily living, our food, daily essentials, and then of course there are other areas like healthcare, clearly an essential service. You want that to continue. You've got things like energy, water, waste, utilities, all of these need to continue. And then food and beverage, we still need to eat, so F&B must continue. But in each of these categories, we kept these categories and we allowed them to continue. But now, having cleared all the appeals from companies that said they wanted to continue, we've cleared the appeals. We are going through all of the existing categories of work that are deemed essential, and we are going through, as I said, step by step to see which ones can be cut further. We are already not doing badly to be able to reduce the workforce that's still continuing to work, right? Not the telecommuting ones, the ones that are still out and about every day, to 20%. We want to go further than that so that we can further reduce the number of people who are out and about and minimize movement to as much as we can.
Let me maybe just take this opportunity to remind all of us that in addition to wearing the mask, personal hygiene is still very important. So I would continue to encourage Singaporeans to wash their hands, observe personal hygiene, and which is a very critical factor in disrupting the transmission chain. And this is particularly important during this period of enhanced safe distancing, and that is why we have also enhanced our advisory on the masks and now making it mandatory when you go out, because we want to do everything we can to reduce the risk of transmission so as to keep our number of cases to as low as possible. And this is in line with our strategy of this enhanced safe distancing approach over the next few weeks.
Can I make one quick point? Just when Minister Gan said this, I remembered something. Please do not use this mask wearing requirement now to say, okay, I can go out. Right? I wear a mask and it's okay to go out, because in fact, you should not go out as much as possible. Just stay at home. do all the right things, practice good hand hygiene, and stay at home as much as possible. And if you're staying at home, you do not need to wear a mask. But in the rare occasion that you do need to go out for purchase of your groceries or purchase of essentials, then it's only at that time that you wear a mask.
Next question.
We'll take the next question from Wall Street. Lisa, please.
Hi, Lisa with the Wall Street Journal. I just would like an update on Trace Together, because it's been a while since we've been given an idea about Trace Together. Can you give us an idea how it's been used by MOM and how effective and useful it's been so far? Thank you.
We are still in the stage of ramping up and to encourage people to switch on this Trace Together. We have a significant number of downloads, but the number of people turning on is still quite low. For this to be effective, we need to have significant portion of Singaporeans turning it on so that we are able to trace those who have turned it on. If only a small portion of Singaporeans have turned it on, then the rest have not, then when we wanted to trace, we would not have the significant number of contacts. So we are still in the process of promoting this app, and we want to encourage Singaporeans to turn it on for as long as possible, especially when you go out, when you need to go out. So please leave it on so that it will facilitate contact tracing. So it is still early days. We are still in the process of encouragement and promotion of this use of this app.
Can I also add that we have always said that it's a useful app, but it's a supplement to all that we are doing on contact tracing. And ultimately, the ability to do contact tracing well lies with the people we have and the skill of the contact tracers. And that's why, Minister Gan, that we have been, all of us, explaining that we have been building up extra capabilities and capacity in our contact tracing team, beefing that up considerably so that that itself will not be a constraint. Even if we have more cases, as we are seeing now, contact tracing continues in a very rigorous and thorough manner.
Next question.
We will now take the next question from CCTV. Sumei, please.
Hi, it's Sumei from CCTV. I have one question. We know in China we do the treatment with a Chinese medicine, 中医, it works. How about in Singapore? Do you think it's possible, because so many cases in Singapore now, do you think it's possible we use the Chinese medicine also to do the treatment? Thank you.
Maybe DMS can comment on the professional side.
In fact, the members of our traditional Chinese medicine physician community have been exploring the possibility of conducting research to see whether or not traditional Chinese medicine has a role to play in the treatment of COVID-19 patients in Singapore. So they have started to engage us, and we continue to have discussions with them. They are also exploring collaborations with the doctors within our public health institutions. And I look forward to seeing research proposals come out in partnership with the doctors in the hospital and traditional Chinese medicine physicians. And it may very well be that some of that research will start in Singapore in the not too distant future.
Next question.
We'll take the next question from Bernama. Masita, please.
Hi, thank you. It's regarding newly identified cluster ABC hostels where 6 Malaysians involved. Would you able to tell who are they? Are they a group of workers who previously commute from Johor Bahru that are housed at ABC hostel during the MCO in Malaysia?
Do you know? We don't have the details of these patients. We'll see whether we can share some of the details with you after we have checked. But we also have to make sure that there's patient confidentiality we have to respect. So we'll see what we can share with you later on when we check the details. Next question.
We'll take the next question from ST. Yuan Sin, please.
Hi. We still have many older workers who are working in essential services such as SMRT or safe distancing ambassadors or security guards. But there has been an advisory issued to encourage older Singaporeans to stay home. So, will this be reviewed? Will some of these older workers be able to stay home instead of going out to work? And the second question is that the DSTA has developed its own, face masks or face guards made out of plastic, right? So how does this compare in terms of effectiveness to reusable masks or surgical masks? And will we be looking at greater deployment of this DSTA face masks as well?
Thank you. I'll ask DMS to comment on the face masks and the face shields that you mentioned, and perhaps Minister Josephine Teo can talk about older workers.
I'm not too familiar with the face mask you're referring to from DSTA. I'm aware that DSTA has been in fact working on various personal protective equipment, which includes face shields as well. So that's work in progress. And as they in fact do this, I understand that they've also been researching what the filtration efficiency is and various other parameters we look at to see whether masks are in fact useful. And we also have various other organizations and agencies, including A-STAR, that also have been actively looking in this particular space. My understanding is that, in fact, there's been quite a bit of progress made in terms of modifying mask designs, such that even the reusable masks, a number of the reusable mask designs, in fact, have some benefit also in these areas. But I don't have enough information to give you today. We look forward perhaps to compiling some information and giving it to you at a later date.
I think it would be a very good thing if the workers who are older themselves are very concerned about heading out to work and want instead to stay home, even if they are performing essential services. It is good that they are mindful of the risks to them and they would prefer not to go to work. Now, what then is our advisory to the employers? Our advisory to the employers is to be sympathetic to the concerns of their senior workers. If it is at all possible to relieve the individual from having to come to work, that would be good. The alternative is that if the person really has to come to work, then within the work environment, can the person be redeployed to a different role where the interactions with the co-workers is kept to a minimum? Thirdly, if that is not also possible, then to find some way of ensuring that these workers are given adequate protection as all essential services workers should be given, meaning that they should be equipped with suitable masks. They should also be provided with the necessary standard operating procedures or processes that have been adjusted to take into account the nature of the work and minimize their interactions with either co-workers or customers or with suppliers. Now, in the event that all of these things are still not possible, then to make arrangements for the worker to stay home, and the preference would be that the worker can clear their leave so that they continue to receive payment. And if after the leave has been exhausted, then to find ways to have an arrangement where the workers as well as the employers come to a mutual consensus. And in those instances, it may be necessary for a no-pay leave arrangement for a period of time. So those are the various options that are available to the workers and to the employers. I think it is really important for the employers to understand and to attend to the concerns of their workers. Particularly for the seniors, we do want to take good care of them. We want to ensure that they not only feel safe if they have to come to work, but are actually well protected.
Next question.
We have time for 3 more questions. We will now take from Itatas. Evgeny, please.
Thank you. Good evening. I just want to clarify about the mask, when these requirements takes effect. And one more question. Some cities introduce electronic passes for residents, and these passes allow them going shopping or make some maybe sport activity. Can we expect to introduce such passes here? Thank you.
Oh, okay. All right. All right. So the wearing of masks takes immediate effect, right? So once we've put it out, the enforcement agencies will start looking at requiring everyone going out to wear masks. As I said, many are already doing it. If you go out today, you already see many wearing a mask. We have made it mandatory in many settings anyway, whether it's a supermarket or public transport. So people are already used to it, and now we are stepping up to require the minute you step out of the house, when you go out, wearing mask will be mandatory. On the idea of regulating the flow of people in supermarkets or markets through some form of a pass system, it's indeed something that we have been looking at. For now, we have, as I said, put in place safe distancing ambassadors. They are deployed on the ground. We have put in place also control access in the control of access into certain places like markets and parks, where we will fence up the area, and then we will control access into that particular area. So if people want to go in, then they will have to queue up. And those sorts of measures, the control measures that we have put in place so far, as I mentioned, have helped to stabilize the situation in some of these areas. And if you look at the places that I mentioned earlier, like parks or markets and hawker centers, the situation today is certainly better than what it was when the circuit breaker started. It's generally under control. But we are continuing to review, and we will see if additional control measures may be necessary to regulate further the flow of people in these areas.
Next question.
We will now take question from Mothership. Julia, please.
Hi. So we'd like to check how long would the mask regulation be in place for, and would it end when circuit breaker ends?
With all of our measures, we will continue to review, so it may well continue after the circuit breaker as one additional layer of precaution that would be put in place for all to wear masks. So we can't say with certain now when exactly this will end and whether or not it will end with the circuit breaker or it may continue. But in any case, as I said earlier, even without making it mandatory, the good thing is that we already see many people wearing it based on the earlier advisory, right? When the earlier advisory was updated, people are doing it and they are conscious and they are aware of why it is useful in order to protect others, to wear a mask, keep your droplets to yourself and you protect others. It provides some additional precaution, additional protection. So more and more Singaporeans and residents are doing it. So we made this additional move now to make it mandatory, but even without it, I would say many are already of their own accord, wearing a mask of their own.
I should also take this opportunity to re-emphasize that at the end of the circuit breaker, we will need to review whether or not there is a need to extend the circuit breaker period, or even if we extend the circuit breaker period, whether we need to make adjustments to the various measures that we have put in place. And it's also important to bear in mind that even at the end of a circuit breaker with or without extension, it's not likely that we will open this entire system altogether and then free for all, everybody do what they like. It is going to be a gradual opening. We may tighten some measures, we may relax some measures, we may fine-tune some of the measures. So it's not a end period and then that's it and everything else back to normal. So we are likely, even if we were to begin to open, to relax, it's going to be a gradual process. and it all will depend on the risk assessment at that point in time. So I think we should not have the idea that at the end of a circuit breaker and everything will revert back to normal and we don't have to wear masks anymore, we don't have to have safe distancing anymore. I think many of these measures, even if we were to relax them, is going to be a gradual process beyond the circuit breaker period. Next question, please.
We'll now take the final question from Bloomberg. Philip, please.
Hi, all. Good to see you all. Couple questions here. You know, the measures are kind of coming hard and fast now. There's lots of press releases coming each day. And, you know, I wonder to what extent the government might admit that it's taking more of a reactive stance on the virus response, as opposed to perhaps more of a preemptive stance that we saw perhaps in the early days when there was more containment. That's one question. Also, I wonder if you could give an idea now what industries you are considering that could be culled from that essentials list. And finally, given the number of cases, what chance do you give the lifting of those circuit breaker measures next month that you were just talking about? Thank you.
So just to clarify, first of all, we are still pursuing containment, right? You said we were doing containment, I think suggesting that we are not doing containment anymore. We are still continuing with containment. We are still continuing with very rigorous contact tracing and quarantine of suspect cases. So that approach has not changed. Basically, we are dealing with a situation where all of us know the virus spreads very quickly and it can move, the situation can move in unpredictable ways any single day, right? So we just have to try our best to adapt, to be agile and to move as fast as we can. We've said from the very start of this outbreak that the key to managing the spread of the virus is not just the measures that we have, but the pace at which we are able to adjust our strategies and adapt to a situation that is very fluid and changing very rapidly, for which the understanding of the virus is also evolving. From the beginning till now, we have continued to learn new things. And scientific advice, not just in Singapore, but internationally, has been continuously been updated and evolved as well. So we are in the same situation yesterday and today. Our posture has not changed. Our strategies, our approach has not changed. It is one of constantly looking at the environment internationally and in Singapore, and then constantly adjusting and updating our posture and our measures, anticipate in a very proactive way, and then anticipating also what can happen in the future. And given the nature of the virus, we just have to be prepared. Anything can happen in the future. That's something we've been saying all along, and that remains the case, that anything can happen, and the way it spreads, the new clusters that form, it can happen in very unpredictable ways, because a single case, a single weak link, can easily lead to new clusters forming. On the second question of what could be culled from the essential services list, I think I must have answered this question at least 3 times. I think all of you are asking me for a specific detail which we are not able to give, because, as I said, the work is happening right now, and when we are ready, we will update you on what is the which are the ones that we will be removing or reducing or taking out from the list of essential services. As I said, the aim, the key goal is to continue to, we started with a list, we've dealt with the appeals, and now we've gone back to that original list that we started with, the sectors that are key and necessary, right? And then we are going to trim it down as much as we can in order to reduce the number of people who are still needed to work on a daily basis. The third question was.
Yeah, maybe I'll respond to that question. I think there was a question about whether we are still hopeful that we will be able to lift the circuit breaker as scheduled. I think it is important for us to remember that we have just implemented the enhanced circuit breaker measures last week, and this is the first week into the measures. We need to continue to monitor how it goes, and at the same time, we also have to see the cases in the dormitory as quite a separate challenge that we are facing, because the dormitories are now being safeguarded. They are quarantined, so there's still some transmission going on within the dormitories, which we are addressing through the joint task force efforts. But that, because they are already quarantined in the dormitories for those with large clusters, I think they are not likely to affect the community outside the dormitories. And then we have also removed the essential workers from these dormitories into a separate accommodation so they don't go in and out anymore. But at the same time, we are also monitoring the transmission outside the dormitory in the community. We are paying close attention to these cases, especially the unlinked cases. As DMS mentioned, we are continuing with contact tracing to attempt to link these cases, to identify the sources of these cases. And we are watching and monitoring the development, and we think that over the next few days, a week or so, we will continue to see the number rising, because many of these infections that we are seeing today are seeded before the safe distancing measures have been put in place. So we will need time for these measures to take effect, and we also need to make sure that we will continue to monitor and adjust our measures as we go along. So I think if we are able to work together, all Singaporeans observe the rules of safe distancing, I think we will be able to succeed in slowing down this transmission effectively. Thank you.